this month alone, U.S. cases have surpassed 4 million. That's more than double the record 1.9 million cases set in October. And deaths are at their highest levels since April and May. Hospitals are facing a crisis level shortage of beds and staff to provide adequate care for patients. Over the weekend, hospitalizations set yet another record. California reports more COVID-19 patients in state hospitals than at any other point during the pandemic. Joining us now, the head of the St. Louis Metropolitan Pandemic Task Force, Dr. Alexander Garza. He is also the Chief Community Health Officer of SSM Health. It's a nonprofit Catholic systems of 23 hospitals. And in the past month, SSM has had to turn away about 50 patients that it couldn't immediately care for due to the strain on the hospital system from COVID-19. Doctor, good morning to you. Thanks so much for being here. Let's start there. You are at the point where you are having to turn away patients. What's it like to have to do that as a doctor? What kind of patients are you sending away? And is this going to get worse for you as this surge increases?
Yeah, well, thanks for having me on, Casey. And so you're exactly right. It's a very discouraging thing whenever we can't take care of patients who need us. And so you're correct. We have either run out of capacity or we are at capacity on any given day. As I checked our numbers last night, we had one intensive care unit bed throughout 8 of our hospitals here in the St. Louis area. And so frequently what we find is that we're having to transfer patients outside of the St. Louis metropolitan area. And so I was at one of our hospitals on Friday, checking in on our staff, and we were actively flying a patient from St. Louis to Quincy, Illinois, because that was the closest intensive care unit bed that we could find within our geographical area, which is shocking when you think about St. Louis as a major metropolitan area, but we're unable to find an intensive care unit bed. And so your question about what types of patients, well, it's all kinds. It's COVID, but it could be, strokes, heart attacks, anything. So once our units get full, that means we can't take care of a multitude of medical cases, not just COVID cases. And that's what makes this a really difficult time right now.
Doctor, when this first hit the headlines in early March, everybody was focused on New York City. The numbers were high, and obviously the media capital of the United States, perhaps the world. So everybody was focused on New York City. And for a long time, people in Middle America saw this as a Manhattan-centric, a Queens-centric problem, a Brooklyn-centric problem. And everybody was warning. Dr. Fauci was warning. Dr. Birx, they were all warning that this was going to be a problem in America's heartland soon enough, and everybody needed to be prepared. It looks like that time is already upon us, and it seems to be getting worse. How dire do you expect the situation to be as we move toward the Christmas holidays?
Yeah, that's a great question, Joe. And you're absolutely right. In St. Louis, we did have a spring surge, but our elected officials here actually were very aggressive in tamping down the cases by doing shelter-at-home orders, things like that. But then as the summer months came on and the cases lulled, then I think everybody was sort of taken into this false sense of security that the pandemic was just going to go away. And of course, we knew that that was not going to be true. But in answer to your question, we do some significant modeling and looking at the data, and we expect the cases and the hospitalizations to continue to increase throughout the remainder of the year. I think the only question is how high are they going to go? So how high are the cases going to go? How high are the number of people that we're going to have in the hospitals? And unfortunately, how high is the death toll going to go as well? We've already started bringing in more trailers to accommodate the people that have passed away in some of our hospitals. And I don't say that to be a fearmonger. It's just a reality. Once you start having this degree of hospitalizations and people in intensive care, you're going to see more people die.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.